Hello, everyone. So let's discuss an important concept and a topic which you should know how to differentiate between mandibular central incisor and lateral incisor. First of all, the mandibular lateral incisor is the crown that tips distally to the distal of the root. Other ways from which we can differentiate the mandibular lateral from the central incisor is the lateral is the large. It is large than like the central. Then it is not as bilaterally symmetrical, but central incisor is. The cingulum on the lateral is slightly distal, whereas on the mandibular central incisor, it is in the center. And on the lateral incisor, the mesial marginal ridge is longer than the distal marginal ridge. Whereas in the central mandibular incisor, they both are of same length. Then we have lateral incisor have the distal proximal contact more apical than the mesial contact, and centrals are at the same level. Lateral incisors, distal incisal angles are more rounded. So they are more rounded than the mesial incisor angles. On the centrals, the angles are the nearly same. So these are the differences we should remember when we are trying to see, okay, this is mandibular lateral or this is central incisor. Then we have the both mandibular and the lateral incisor have the lingual cervical line that is positioned more apically than the facial cervical line. So remember this. This is a very important topic. You must know how to differentiate between maxillary central from the lateral and mandibular from the like the lateral from the central, okay? And you must know that which tooth has like mesioincisal angle sharper or rounded, and then how is the cervical line, and are they like any the root is like bending towards any side like this. All these differentiated difference should be noted so we can answer the question in the ADAT exam. Thank you.